Good morning. On behalf of the NC Chamber, welcome to Preparing for a Safe Return to Work. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, please use the question and answer box. We ask that you do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. The recording of today's webinar and any slides will be made available to you via email within 24 hours of the webinar. Now, I would like to introduce Beth Shore, Vice President of Member Engagement with the NC Chamber. Beth.
Thank you, Janelle. Good morning, everyone. It is my pleasure to introduce Mindy Schestag, Director of Operations for Manpower North America. Manpower, the leading global workforce solutions company and cornerstone member of the NC Chamber, helps organizations transform in a fast-changing world of work by sourcing, assessing, developing, and managing the talent that enables them to win. With more than 15 years experience in staffing and human resources, Mindy's key areas of expertise include staffing technology and automation, process efficiency, and continuous improvement. Recently, Mindy has led Manpower's pandemic response team. Mindy, thank you so much for being with us today and providing guidance on a safe return to work.
Thank you so much, Beth. I'm so excited to be here and join the Chamber. Excited to be able to share some practical tips for returning to work safely. I know COVID has been top of mind, and now we've all been talking about it for, it's amazing that it's gone fast, and at the same time, it feels like it's been a long time that we've now been talking about COVID, but coming up on a couple of months here, and we've learned a lot of great tips around safety. We've really been through a roller coaster and just hoping that we can share some practical advice with you. So thank you so much for the invite today and looking forward to today's connection. I want to just touch base just for a moment to say that we are an employer just like you. We have the unique position to be able to work with a number of companies, thousands of companies across the country, and have an inside view into the safety guidelines that they're putting in place and also help consult with those companies who maybe are struggling around their safety practices. So safety is highly important to us, but we want to remind you that you should certainly work with your own legal and HR teams before you change any policies or procedures. We're happy to share our guidelines and our advice here today, but just want to remind you that local guidelines and local governance can change quite significantly from one location to another. And so certainly check those local guidelines, and today's presentation is intended to be helpful and provide some general guidance to you. So with that said, let's take a look at our agenda for today and talk through our scope of conversation. So today we will spend a little time talking about the new future of work, what we're seeing and what we expect to see in the next few months. And then we'll spend most of our time talking about what we consider work ready. Manpower's put together a great work ready program, so we wanted to share that with you and hope that you can take some practical guidance from that. We are seeing a number of new work ready jobs and services emerge as we're seeing these changes in the world of work. And so we wanted to talk about some of the trends there with new jobs and new services, and then talk about practical tips for where you can start today. So talk about our focus for today, and then hopefully we will save some time for Q&A at the end. So we'll go ahead and move forward, and let's start with the new future of work. So we wanted to talk on the next slide around some macro trends that we're seeing as the current normal. And we've seen a few iterations of what the new normal is. And so today we really wanted to talk about the current normal. And we're seeing really 5 key macro trends in the world of work that we wanted to start by setting the stage for today's conversation around safety. So first, what we're seeing is a significant workforce shift. And I'm sure that all of you can acknowledge and see where you've seen these significant workforce shifts and at speeds that we've never seen before. This is the fastest we've ever seen over a span of a few weeks rather than a few months or even years. We've seen changes in the workforce. Almost overnight, we saw approximately 30 million jobs lost. And we've seen workforce shifts that we haven't seen in our company's 70-year history. So those workforce shifts have caused us to have to react much faster than what we've had to in the past in the world of work. As a result, we've also seen new roles emerge. So as fast as other roles have declined, we're now talking about brand new roles, things like contact tracing, which we had never talked about or very rarely talked about. Prior to this pandemic, we're seeing brand new roles emerge: contact tracing, temperature checkers, health surveyors, and then other roles are emerging or increasing: sanitation, cleaning staff, app developers, software developers. You're seeing in the retail environment, many retailers and food distributors are having to ensure that they have apps available in order to continue to do business. And so we're seeing some emerging roles there. Third, we're seeing employers are really rethinking what's needed for a role versus what's desired. So they had a talent shortage previously. They were really ensuring that anyone that they hired had the exact skills that were needed. And now in this new state of employment, they're really rethinking what are the critical skills that are needed for that role versus what do they desire to have and what can they build. They've seen employees take on new roles and build new skills during this time. I think we've all learned a few new skills if we've continued working through this pandemic and through the last few months. I think we've all added some new skills to our resumes. And so employers are really rethinking what's needed. And we're seeing a significant shift in job adverts that are posted and the number of skills that are being requested or required in those job adverts is really dropping significantly. So employers are really thinking rethinking those critical skills versus what they desire to have. More than 60% of job postings have less requirements now than they did in January. So that's a really fascinating trend that we're seeing. Fourth, we really view that we're going back to the future of work, not the past. So we really see that there is a change in the way that we're working. We all, or many of us, were forced to work virtually or just think differently about how we worked. Many of our employees were learning to work virtually during this time where possible. And we've seen manufacturing changes, service changes, all kinds of industries have had changes. And now as we consider going back to work, we really need to think about how do we keep our employees safe? How do we safely return to work? And what are employees really looking for when they're looking for flexibility in the workplace? We've talked for a long time about moving to a more virtual environment, a more flexible work environment, but we've really been forced into that over these last couple of months. And I think that for our employees to feel safe, we are really going to have to think differently about work. I also think many companies are thinking differently about their real estate strategy, what roles can be done virtually, and it really enables them to look differently at talent. They can open up their talent searches to other places in the country or places that aren't easily able to arrive through transportation if they open up their talent search to other areas and think differently about virtual work. Finally, work's being categorized in new ways. How we value essential work has shifted for the long term. We were definitely moving toward a heavy focus on service industries, and overnight we saw that change, and the view on essential work has shifted really significantly and almost overnight. We saw manufacturing jobs, grocery store workers, convenience store workers, frontline healthcare workers really be considered those essential work. And there's a high value both with hard costs, and we see our employment costs going up in some of those areas, but also in soft costs. The importance that we're putting on essential work and how we talk about those essential functions and how we keep them safe has changed overnight. And so we're really defining essential work differently, and that's starting to evolve the way we think about workforce trends moving forward. So on the next slide, I'd like to talk a little bit about what we're hearing from our clients specifically. We talked about workforce trends, but we want to talk about what we're hearing directly from our clients. We actually have completed a survey with our clients, a simple survey, but we're also talking to our clients daily to better understand where we can help and the challenges that they're facing during this pandemic. And so the key themes that we're really hearing from our clients Number one is employee retention and the return of their employees. Our employers are concerned. We are concerned about the return of employment. Unemployment is tough to compete with. The stimulus packages are also tough to compete with. And so we're hearing from a lot of companies that they're concerned about who will return to work and what that return will look like, and will they be able to get the employees they need when they're ready to reopen, or now as they are reopening. And then we're also hearing about major concerns about safety best practices and the status of their recovery plans. So most employers know or are in some state of a recovery plan, but either they don't know where to start, they haven't started, or they're in the middle of it and feeling a little overwhelmed. And so that's really where we wanted to spend our time today, was talking a little bit more about the safety advice and the guidance and how you can ensure that you have a recovery plan in place that's holistic and makes your employees feel safe. We're having completely different conversations about safety today than what we had just a few months ago. And so we've held a series of webinars addressing a number of these topics, and I'll be happy to provide some resources after the fact if you're interested in some of the other topics we've provided. But today we're going to spend our time talking about the safety. So toward the end of our conversation today, we'll also open it up for questions. And I'm interested in hearing from you on what you're seeing in your return to work and where your focus is as an employer. So let's go ahead and spend some time talking about what Manpower calls work ready. So work ready for Manpower, and we can go ahead and move right into the next slide, Talisa. So work ready for us really is the way that we are thinking about bringing people back to work. It's really not as easy as flipping a switch. When we did flip a switch at some point, almost overnight, to change the way we were working at the start of this pandemic. But as we look at bringing people back to work, it can vary considerably across the country, from state to state, and then even from county to county or location to location, city to city. Those work safety standards vary for every location. So we created the Manpower Work Ready plan to ensure that we had a holistic plan to make sure that we were keeping all of our workers safe. And we're in a unique position because we are sending associates out to work in work sites that we can advise on but don't have control over. And so we wanted to make sure that we had a plan that allowed us to understand and assess a work site and communicate the importance of safety to our clients and to our workers. And so our Work Ready plan is really about setting safety standards. It includes 3 key elements: health and safety protocols, an enhanced safety training plan, and then health checks for our employees. So we'll take a closer look at the Work Ready plan and each of these elements. Our Work Ready plan includes enhanced training. And for us, Work Ready really means that our employees feel safe, know that safety is important to us, and that we've provided some additional training. So we've created some very quick but easy training for all of our workers to complete, and is applicable and easy to update at any time and any stage of this pandemic. So initially it was all about preparedness and prevention, and now it's about the safe return to work and the safe use of PPE. So enhanced training was really the first step of our Work Ready plan. The second was new protocols. So as we talk to our clients, we have many clients that were considered essential clients, many companies, I'm sure some like yours, that were considered essential and continued to remain operating, but needed to learn to operate in different ways. So we established some new protocols that looked at health and safety in a different way. And so we've been able to have these conversations with customers and clients around their safety protocols and ensure that we were speaking the same language and had the right protocols in place. And then wellness screening. So we have implemented new screening procedures. How we apply those screening procedures vary depending on the level of risk, and we'll talk about that in just a moment. But our wellness screenings allow us to be flexible and ensure that we have a screening process in place and a communication protocol in place should we have some exposure in the workplace. And it allows us to ensure that we have a safe return to work, whether it was at the start of a new job or somebody's returning to work after a furlough. It ensures that we have that safe and well-screened employee ready to go back to work. But what really matters most to us is protecting our people. And we want to make sure that all of our workers know that their safety is important to us. And so part of our Work Ready program is just establishing that dialogue with all of our workers to make sure that they know that safety is really first on our minds and what's most important. It is important that we get back to work, but we have to do it safely. So let's take a closer look at how we did this. So our Work Ready program, we talked about the elements included in that Work Ready program. I thought it would be helpful to share just a couple examples of how we implemented this So really we had 3 key elements in how we protect our people. And the first was communication. So internally, we rolled out some new office guidelines around what safety means for us. And then, as I mentioned, we rolled out some new safety training. So we built some quick and easy training that was applicable to all of our workers. And it focuses on prevention, but it also helps them to understand what to do if they happen to interact with someone who then later is found to be presumed positive, if they're experiencing any symptoms of illness. It really just ensures that they have the foundation and know how to proceed and who to contact in the case that they have any type of exposure. And then finally, those health checks that we talked about. It's just quick and easy health checks. Some of these are in person, sometimes it's electronic. And so we allow our workers to apply these health checks in the way that makes sense based on the risk level that either the work site is in or the role is in. And we'll talk a little bit more about our health and safety protocols and those risk levels in the next slides. So that's how we're protecting our people. Let's talk a little bit about the worksite assessment. So safety has always been a huge concern for Manpower. It's always been one of our foundations. And to be honest, until recently, we've had some safety practices that have been in place for a very long time. We're experts in safety. We're experts in assessing the worksite risk in a manufacturing environment or a company where we are sending our associates, but it's really been about worksite risk, that OSHA risk that we're concerned about, machine safety. Until recently, we hadn't really thought about the health risk that might exist at a worksite, and this pandemic has changed that. So one of the ways that we changed our protocols was really to implement a new worksite assessment. We didn't change the manufacturing safety that we were concerned about or any of the other safety protocols, but we've really enhanced those. So we've added this worksite survey supplement, and this we see as something that will continue to evolve. So for now, we've added this COVID-19 supplement, and we anticipate that this will evolve over time. And as the risk of COVID hopefully decreases over the next few months, or perhaps even the next year, we believe that this will evolve, and we'll continue to ensure that we evolve our worksite risk assessment to include health and safety assessment moving forward, maybe just not so specific to COVID. So that assessment now includes things like questions around health monitoring. What are those work sites doing to monitor health? Are they implementing social distancing according to recommended guidelines and where we are in the curve at the moment? Looking at protective equipment, again, we've always been concerned about safety glasses, but now we're thinking about masks and gloves and hand sanitizer. So we're talking about protective equipment differently, as well as hygiene and sanitization. And then finally, case management and communication, ensuring that every work site has a plan in place. Communication is really critical. Case management is also critical, making sure that we're not reactive and that proactively we have case management plans in place. And then finally, those risk level protocols that we can apply. And so we are able to assess based on the assessments that we've created and put our work sites or our roles into 3 categories. And they're pretty simple: high, medium, and low risk. And then we apply different protocols for health and safety based on the different levels of risk. So I wanted to give you a glimpse of the assessment that we've created and just some ideas that you can think through if you want to think about assessing your work site differently. So the first, this slide here gives you an idea of some of the types of questions that are on that assessment supplement that we created. So some of the key questions we ask to ensure a work site is safe are things like, is a health screening plan in place? Can social distancing be maintained at all times? Have we identified what personal protective equipment is required? Again, that's very specific to the role, the location. Retail is very different from manufacturing. The number of visitors that you have, the volume of people that you have in any work site can change the protocols that you have to put in place. Do you have an ample supply of PPE? Can you get that supply through your supply chain? Do you have access to what you need? Do you have a proper cleaning plan in place? What does a proper cleaning plan look like? And what does the CDC recommend for sanitization? Are we limiting the sharing of tools and equipment? How often are tools and equipment cleaned and disinfected? Do we have to purchase new tools to ensure that we don't have as much exposure through shared tools? Those are just some of the ways that companies are investing in making sure that they're thinking about preparing their work site safely. And then what controls do you have in place to prevent the spread of COVID? And have there been any diagnosed cases? That can all factor into the risk level of a particular work site, and it could change over time. So again, this may not be a once and done type of assessment. It might be something that you implement on an ongoing basis. Perhaps you consider assessing your work site on a regular basis for now, and you reassess that work site on a monthly basis or whatever cadence makes sense for your company. So let's talk about the risk levels based on those questions that we ask in that assessment. Then it allows us to really understand, is this a low, a medium, or a high risk work site? And for the most part, we can assess risk based on work site, but there are some roles within certain work sites that would also be considered a different risk level than the overall work site. So for example, a healthcare environment that's not dealing with COVID patients might be considered a medium risk site, but those that are directly coming into contact with patients might be considered high risk, versus those that are working behind the scenes, or a file clerk might be considered a lower risk because they're not coming in direct contact with patients. So for the most part, we do apply these risk levels at the work site, but we also look specifically at the roles within the work site and make sure that we're applying the right protocols. This is just one look at how we assess work sites, and there are some great materials out there. And one of the resources that I'll provide you at the end of our time together today will help you to understand different risk levels by industry. We have a really detailed guide that can be helpful for you to understand the different work site risk levels. So let's talk a little bit about recovery plan. We've talked about how we assess a work site and how we consider work site safety, but we want to talk most of today around the recovery plan and how we've changed how we think about recovery and how we reopen safely. So we've broken our recovery plan down into 5 key critical components, and there might be more than these components on your plan, but these are our 5 key critical components when it comes to safety of a work site in particular. So we've broken it down into facility planning, health checks and monitoring, communication and case management, sanitization and hygiene, and procuring PPE and equipment. So we will take a look at our different risk levels and spend some time walking through each of these 5 categories and plan components and what the different risk levels might look like, the different mitigation factors that you might take in your work site based on whether you're at a low or a high risk work site and across all of these critical components. So we'll start with facility planning, and this is where we'll really start to dig into some great content. And actually, I'm gonna just give me a moment. Let me move this off of my screen so that I can see all of the important risk levels. All right, so for all sites, and regardless of risk level, there are some basic techniques that you can put in place regardless of your risk level. And so there are some basic foundational items on all of these categories that we think you should have in place. For all sites, you really, as a foundation, should have safety posters, hygiene reminders, mark your floors for social distancing, and then consider erecting physical barriers. Those physical barriers might be specific to certain roles, but those are some techniques you can put in place in any sites. If you need safety posters, some of you have probably done a great job of creating your own, but the CDC can also be a great resource. OSHA has great material available. Just make sure that you're looking at all of the resources that are available to you. You certainly don't have to recreate the wheel. You don't have to create custom content for everything that you do. There's a lot of great information out there, and the CDC and OSHA have provided some great guidance. So no need to create something on your own, and leverage those safety posters and hygiene reminders that are already out there. For those lower risk sites, you might also consider some basic things. So things we've done: moved furniture. If you have a waiting room, remove some furniture and place your waiting room chairs 6 feet apart from each other so that you're not constantly having to monitor or remind people to stay further apart. Relocate seating, and then think about your internal staff as well. Stagger meals and breaks. Try to reduce the amount of traffic in your break room. In some cases, we know that work sites are actually closing off break rooms and just asking employees for a short period of time, eat at your desk or eat in a remote location, and make sure that you're not sharing food in a high traffic location. For medium risk locations, consider dedicating space, limit your shared facilities, mark floors by line. So if you're in a manufacturing facility, there are some great techniques you can use specific to your manufacturing facility. So if you have lines, production lines in your workforce, you can mark the floors by those lines. Sometimes it's hard to remind people to stay in a certain area while they're working a production line. So really marking the floors to say, stay within this range of space allows people to move around a little bit and also helps to just provide a physical reminder to your workers of staying safe. You can also mark the floors by worker, make sure that they have an area of access that's marked out safely for them to navigate. You can monitor social distancing. So again, when we talk about emerging roles, this is something that we never would have thought would be a role that we would staff, and we've definitely seen companies taking this route. So if you think of this as like a hall monitor, we have several companies and clients who are hiring monitors for their locations, helping to remind people to remain social distance from each other and to maintain that social distance. Reducing visitor access can be an easy way, changing your visitor protocol from walk-in traffic to by appointment only temporarily. That's a technique that many clients have put in place. For manufacturing facilities or those companies that have clocks for checking in and out, or maybe a paper spreadsheet where people are writing in their in and out times. This is a good way to ensure that you don't have a high number of people congregating in a small space. So you can increase the number of clocks temporarily that you have on site. You can stagger your start and end times, ensure you have employees that are arriving and leaving at slightly different times. That's a fairly easy way to ensure that you don't have a large group of people that are congregating all in one place in one small period of time. And then finally, some of those high-risk locations, ways that you can plan out your facility plans and make sure you're retaining safety in your facility would be things like relocating lines. We have a number of manufacturing companies that were considered essential that had to make some pretty drastic and fast moves to ensure that they were keeping their employees safe and keeping those essential products that were coming off the line. So they've actually taken open space and relocated lines to limit the number of people that were coming into contact with each other. We also have clients that are limiting their meeting sizes, limiting shift sizes, changing from 12-hour shifts to 8-hour shifts, and then reducing the size and the number of employees that are on any particular shift. It's a great way to ensure that you could keep people working and keep your production up, but it limits the number of people that are coming into contact with each other at any time. And it really enhances your ability to be able to social distance within the workplace. Also, some changes you can make to your facilities. Relocating PPE, thinking about that industrial safety, thinking about where you have PPE stored. It might have been okay to just have it in a closet in one central safe location previously, and then you have your workers go to the location of PPE. At this point, it might be easier to bring the PPE to your employer. So that personal protective equipment, the masks, the gloves they need to be safe, consider relocating that or creating multiple locations to store the equipment they need to do their job. It really reduces the amount of travel they have to do in the workplace and limits the exposure. Also review some things like your traffic flow. So we've all seen this in grocery stores, we've seen it in retail locations, but consider if this is something that makes sense. Even in small work sites, you can create some basic rules of understanding or rules of engagement that allow you to monitor your traffic flow and ensure that you all are working on the same pattern to reduce the amount of exposure that you have. All right, let's go ahead and move on from facility planning to health checks and monitoring. We have a number of sites that have implemented health questionnaires. We talked about that a little in the beginning, but these health questionnaires can be applied in all different ways, and all sites can implement a health questionnaire. The question is, how frequently do you need to do it? How do you implement a health questionnaire? And we'll talk a little bit about emerging roles that we're seeing that are arising out of the need to do these health checks. But implementing a health questionnaire is a fairly simple way to ensure that either your employees are doing a self-check and checking themselves for certain symptoms, or that you are checking them at the time of arrival or prior to the start of their employment. And then communicate those self-monitoring techniques. Make sure that that's staying top of mind for your workers and that you have good plans in place to communicate on a regular basis. Sometimes as we stop thinking about or stop talking about some of these items, we become less diligent. So it's an important part of your plan to ensure that you're communicating on a regular basis and keeping it top of mind for your workers. For low-risk sites, you might consider a pre-employment health check. Perhaps you have new workers that are starting or returning from furlough. So you implement a pre-employment health check that ensures that you put a questionnaire in place, you ask if they're experiencing any symptoms, and then you also notify them of the practices to self-monitor each day before work and the process that they need to follow if and when they happen to experience any symptoms. You might also consider a pre-arrival temperature screening. So perhaps you don't want to check temperatures at the door, but you'd like your employees to self-check their own temperature. We have some companies, we know of some companies that are doing this regularly. Some are doing it at the time of arrival, but others are just relying on employees to check their temperature before they arrive each day. They may or may not be asking them to record it, and that really depends on that level of risk. For medium risk locations, perhaps you increase your health monitoring and you move to a weekly health check. Perhaps you check in with your employees once a week, you have them complete the questionnaire, or you do a round robin and make sure that you make it through an inquiry with all of your staff once a week. You can also consider a pre-arrival health check for your medium risk locations. And then a lot of these locations are really considering that temperature screening. And again, this is where the local guidelines and regulations can vary pretty considerably. So there are some locations that require that employers have a temperature screening plan in place, particularly for medium or high risk locations. In other locations, it's really up to the employer to decide if temperature screening is something that's going to be part of your return to work. But the CDC certainly recommends that you have some level of health inquiry, health check, or temperature screening plan in place. So it's a good idea to make sure that you thought through this and made it part of your strategy at some level. For high risk locations, consider a daily health check, temperature screening, infrared scanning. We have a number of clients and companies that have installed and really invested in infrared scanning equipment. And that really accomplishes two things. One, it can increase the speed at which your employees can get to work. It scans those employees as they arrive and walk through the door. It doesn't necessarily require a handheld temperature screener, but it can just screen all of your employees as they come in. It also ensures that your employees see and understand that safety is important to you, and you're monitoring the health of all of those who are visiting to ensure that you're keeping them safe. So that's something that we've seen a number of clients implement. And then finally, if you're a high-risk location, consider an on-site nurse. There are a lot of medical facilities out there who are seeing high demand for on-site nurses at this point. So that's something that you may want to consider. So as we talk about some of those roles, we'll move on to talk about some of the emerging roles that we're seeing right now. One of the worksite shifts that we've really seen considerably emerge during this time is these temperature screeners. This wasn't a role that we had in place prior to COVID, and it's really something that we're seeing emerge as a significant need for companies across the country. So whether you have an employee who you think can move into this role, or you have to buy this talent elsewhere and you need to hire somebody on a temporary or permanent basis to take on this role, we're seeing a lot of movement toward having dedicated screeners at the door, temperature screeners that are from a safe distance, screening employees and understanding if they have a temperature. It's one way that they're using to eliminate or reduce the amount of exposure that they might have in their work site. So really solutions here are twofold. You might just implement a person and add that person to your team, or you might need a solution. You might be an employer that's thinking, I don't even know where to start with this. I'm not comfortable with this topic. I'm not comfortable. I don't know what my requirements are as an employer. And so there are definitely some solutions out there for you where you can really hire the talent and the program. And some companies have great solutions, Manpower included. We have created some solutions because we know employers are in this boat and don't really know where to start. And what you really want to focus on is getting back to work, and you don't want to be experts in the world of temperature screening. And so this is an area that we're seeing certainly emerge in our workforce trends. Related to temperature screening are these health survey administrators. And so this is taken on a couple of different views. So we're seeing health survey administration both on an on-site level. If you think about this similar to temperature screeners, this would be a person who essentially stands at your door and screens your visitors or screens your workers, has them complete the health survey, may or may not be checking temperatures, but really has a protocol that's assigned and in place to assess the current health of your visitors and your employees, and then provide them with advice and guidance. If they're experiencing symptoms, they can provide guidance around next steps. They can also be following up and ensuring that there's a communication plan in place on how to follow up on symptoms, where to go for health care, and then how to safely return to work when the time comes. We're also seeing health survey administration take on a virtual path. And so while health surveys in some cases may need to be done on an on-site basis, we've definitely seen it have a role virtually as well. So checking in with employees, whether through technology or picking up the phone and calling someone or texting your workers to find out how they're doing either before they start work or after they've had symptoms. These health survey administrators can really help us to capture and retain the safety and confidentiality of this information. So the critical components of this are you need someone to administer the survey, capture the health data, keep an ongoing safety analysis, and then isolate your risk. And so, we certainly want someone to feel that their confidentiality is important. And so having a dedicated process and practice for health survey administration is important to your recovery plan. All right. So let's move on to sanitization and hygiene. This is the next category for our protocols. For all sites, what we're really seeing is, again, this is where we see those safety posters are important. I think we've all probably had some prevention and hand washing posters up since the middle of March, but ensuring that you're updating those postings and making sure that now you're talking about cleaning protocols and hygiene reminders. It doesn't hurt to continue to make sure that you're updating those safety posters at all times. Procuring equipment and hand sanitizer as well as disinfectant is something that I think is top of mind for everyone. Those are items that can be difficult to find at this time. I think we're finally starting to see some increase in hand sanitizer being available in a retail environment or being available for order. The supplies are up in that area. Disinfectant, also the supplies are finally increasing, although those are still a little bit harder to find. So really start thinking about increasing your supplies if you haven't already. There's a lot of supply chains out there that can help you. And so, certainly this is a good opportunity for you to use your chamber network and make sure that you're looking for those providers. And I'm sure that you guys already have been working through that with your teams. And then finally, monitoring those local guidelines. The sanitization and hygiene standards can be one thing, but requirements can be specific to the location that you're in. So really making sure that you understand the requirements in your workplace and in the location in which your workplace resides is something that's very important. In the low-risk locations, hand washing breaks and reminders are critical, making sure that you remind your staff. Again, out of sight, out of mind. This is something we were all doing regularly in the middle of March. We were all washing our hands more than we'd ever washed our hands before, and reminding our colleagues and reminding our kids and making jokes about it. And at this point, it started to die off a little bit. I think we're probably all a little guilty of that. And so ensuring that you just establish those protocols, you can make some fun reminders out of it. You can make it fun for your team, but making sure that you remind them, take breaks, and make sure that you stagger those throughout the day to ensure that they're keeping that top of mind. And then really updating your cleaning regimen and your cleaning protocols. Supply your workspace with disinfectant. We might be asking our teams to disinfect their work sites and workspaces a little bit more than they had before. And then really ensuring that you post those cleaning protocols and regimens with your team so that they remember to clean their space, but also so that they understand and the communication is there that sanitization and cleaning is important to you as a company and important to keeping them safe. In medium risk locations, consider implementing hourly hand washing breaks, clean shared equipment. We've seen in manufacturing environments actually create a break in between shifts to clean shared equipment. They're really increasing the amount of time between shifts and the taking breaks within the shift to ensure that you have a more critical cleaning protocol in place for those shared or high risk areas. Remove shared coffee stations. We love to be able to provide perks to our workers, but we also want to make sure that we keep them safe. And so consider temporarily removing shared coffee stations. Clean, if you have, single-use coffee machines, consider keeping those, but cleaning those on a regular basis, or asking your team in small workstations to just clean that after or before every use can really cut down on the amount of potential exposure. Deep clean between your shifts, and then really consider increasing air exchanges. So one of the things that we have worked with with landlords and facility maintenance companies on is really understanding what our capabilities were. So we've had more conversations with landlords and real estate companies than we've ever had in the past on this frequent of basis, talking about what can we do to keep our workers safe and what can we do to increase our air exchanges, or change out our filters on more regular basis, just make sure that we have a more critical protocol in place. And then finally, high-risk locations. Consider those same hourly 30 to 60-minute hand washing breaks. Procure additional tools. Reduce and eliminate sharing of tools and facilities as much as possible. And then really think about increasing your cleaning staff. If you have to disinfect regularly throughout the shift, perhaps your production is down, maybe you haven't been able to get all of the supplies that you have needed in the past, or maybe you're in a service industry where you're only partially reopened. So consider keeping your staff at full time, but using them to disinfect throughout the shift and increasing those sanitization protocols. And then really in those high-risk locations, consider auditing those cleaning protocols. Sometimes just putting a rule in place or a guideline in place isn't enough, and you really need, similar to those hall monitors and those social distancing monitors, consider an audit process. If you haven't had it before, maybe you don't need it forever, but in the interim, perhaps you create an audit protocol and you have a more formal process in place to audit cleaning and to audit that your employees are keeping up with your cleaning protocol as designed. And then the best way to understand if you're really hitting the mark is seek some staff feedback. They'll be the first to tell you if they feel safe and they feel like their workplace is being kept clean. So consider some anonymous options, some regular surveys, but really seek staff feedback because they're in the best position to tell you if they're feeling safe and feeling like the worksite safety is important. Okay, so let's take a look at what we're seeing in terms of roles for sanitization services. So in some cases, as a company, you already have some type of sanitization program or sanitation program in place. In other cases, perhaps you just had your workers clean a little bit here and there in between shifts, and it wasn't really something that you had a huge protocol in place for. So this is an area where we're seeing that companies are really having to enhance their safety protocols, at least temporarily. So we've seen a serious increase in the number of sanitization roles just in the last couple of months, and particularly in the last week or two as companies are reopening and ensuring that they're in a position to reopen safely. We've seen a pretty significant increase in these types of roles. We're also seeing a high demand for companies that provide this as a service. And so this is something that you might consider, whether you add this as a role to your team or you take this on as a service. But we're seeing an increase here, and the growth in these roles, they're not new, but the growth in these roles has been significant. And we anticipate that this is something that will be sustained through the end of the year. All right. So on the topic of sanitization and safety in the workplace, we're going to move on to talk about protective equipment and how you can ensure that you have the right equipment in place to keep your employees safe. So for all sites, you want to make sure that you have some documented policies. Masks are something we've all heard a lot about. We've had a lot of conversation around masks and facial coverings and what type of masks. And we've all had conversations about N95 masks and the appropriate type of mask. I've never spent so much time talking about the specifications of masks and making sure that we're ordering the right thing. So all sites should think about their mask or face covering policy, ensure that you understand what the local guidelines are around face coverings, and really consult those local government orders for this one. In low-risk locations, you could consider just evaluating homemade masks, procuring commercial, and when I say commercial, again, this is very specific to the environment, not recommending that you use N95 masks in these low-risk locations, but just understand the different type of masks and make sure that you're utilizing those that are appropriate for your work site and your location, and utilize those face coverings that make the most sense for your work site. For medium risk locations, again, evaluating homemade options, procuring commercial masks. I think many visitors and shoppers now have their own masks. They're being asked to use when they visit locations. So I think a lot of locations, again, this depends on where you are in the country, but a lot of locations have pretty detailed requirements around whether masks are or not available, and a number of people have options and access to masks at this time. But it's also something that you might need to consider procuring in bulk if you are in a location where you need to ensure that you have commercial masks readily available or disposable masks readily available to your visitors and to your workers. And certainly supply chains can be helpful to you to make sure that you have access to those. We're definitely seeing an increase in this, the availability in the last couple of months. Assess mask safety. Again, think about things. So we talk a lot about facial coverings and masks, but you also need to think about the safety of those facial coverings for your work site. And so manufacturing facilities are a facility where you really need to think seriously about the safety of masks and ensure that you have a policy and a protocol in place that keeps your workers safe. Machines and face coverings that hang down may not be a great combination. And so ensure that your teams are following normal safety protocols through your work site, but also following health safety protocols that make sense. And then consider gloves for certain positions. And that's one of the things that we have found has been most difficult to find, and we haven't really seen the supply increase yet. And so that's an area where if you think you might need them, you may want to make sure that you start procuring those as soon as possible. For high-risk locations, and again, this can be specific to those healthcare locations, very specific locations that are are at high risk, then you may need to procure those N95 or surgical masks. But leave those to those who need them and ensure that you're really only applying the right mask for the job that you need to do. And then for these high-risk locations, you may need to implement some cleaning protocols for protective clothing. Healthcare companies have been doing this for a long time, but for those environments that might be new to a high-risk location, if you offer uniforms or have protective clothing, even in some high-risk manufacturing environments, consider an updated cleaning protocol for that protective clothing and make sure that you're up to date on your cleaning protocol. And then finally, one element of training that we have implemented and seen implemented in a number of high-risk locations is really increasing the amount of training around PPE. So we may have taken this for granted in the past, but we have a lot of people now who are learning how to properly use gloves, how to properly use don and doff face masks. And so providing some training to your workers around proper use of PPE is really important during this time. Finally, we're going to talk about communication and case management. So as important as it is to be proactive and to think about our work site differently, we also need to be proactive and think about communication and case management so that you can avoid being reactive in these cases. So for all sites, you really need to document in advance a case protocol. Even if you're in a low-risk site, it's really important that you don't find yourself in a position where you're having to scramble because somebody calls you and says that they were in your work site and they've been exposed or tested positive to COVID, and suddenly you're having to scramble and come up with a plan to make sure that you understand how to trace any potential contact and to assess the exposure risk to your work site. So make sure that you think through your case protocol and document your case protocol in advance. Your case protocol should include elements such as case management, communication plan, a contact list. Think about who you need to contact. This is where that contact tracing role comes in, and we'll talk about that in just a moment. Make sure you have an exposure plan in place and then a support plan. So who on your team is going to help support and how do you execute the case protocol. For low-risk locations, make sure you draft some communications, have those ready to go, and in advance, identify key roles on your team, and then reassure your team that you have a plan in place. For medium-risk locations, it's probably best to post your emergency protocol, promote your EAP in advance, your employee assistance program if you have one. If you don't, talk to your healthcare provider. A number of healthcare providers have offered enhanced or free resources during this time to ensure that employees have what they need. So consider teledoc options and an EAP program, and then promote those within your team, whether through communications or posters in your work site. And then finally, those PPE reminders that we talked about earlier. Make sure that your team understands what protective equipment is required. For high-risk locations, this is where you really need to have a robust contact tracing plan in place. CDC and OSHA are asking us to ensure to safely reopen, that we have a plan in place should there be exposure, to try to make sure that we can trace any contact of that exposure to try to limit the amount of future exposure. And so make sure that you have a robust contact tracing plan in place. You should communicate your emergency procedures, develop message templates, have those ready to go, plan for the worst, and have those plans in place and hope that you don't have to use them. And then develop a robust return to work policy. Make sure if you do have exposure that you have a plan in place and that your workers know how to safely monitor and return. And then refresh your business continuity plan. Make sure that throughout the time that you're returning to work, that you are refreshing your continuity plan so that you're ready for whatever might come your way. So finally, what the last emerging role we wanted to talk about was contact tracers. And this is certainly something that 8 weeks ago or 10 weeks ago, we weren't hearing a lot about. We had heard about them a little bit in the past, and some government entities had some contact tracing plans in place. But as a business, we hadn't really thought about contact tracers or talked about them at all in our standard operations. And now it's the top of our mind, and we're talking about the number of roles available and the growth in this industry. So contact tracing is really about identifying and isolating if there's been some exposure, and then recalling contact and documenting the amount of contact that might have existed with that person, mapping out the risk, connecting and warning to those people who might be at risk. And then most critically, making sure that anyone who might be potentially exposed has a quarantine protocol in place and a follow-up plan. So make sure that we understand as they move through that quarantine process that safety is important, that their health is important, and that you have a plan to continue to check in proactively and help them return to work as quickly as possible, but as safely as possible. So our contact tracers are really helping us to work through this protocol. And so we've seen some increase in roles. Some companies have decided to take this on themselves, and they've added these roles to their own teams. In a lot of cases, what we're seeing is that this is emerging as a service. So there are some services that are becoming experts in contact tracing, so that as a company, you can reach out to them and contract their services, and you don't have to be experts. You just need to know that they're there for you should you have exposure. And that can really provide some value and some reassurance to you as you work through your plan. So that's a lot of information, a lot of guidance, a lot of what we've learned through the last couple of months of handling COVID-19 and really any pandemic that you might have to deal with. But I think we've talked at length about these safety steps that get us through today and tomorrow as you think through your own recovery plan and your own safety plans. I want to pivot for just a minute because it's probably a little overwhelming. It's been overwhelming to us as we've worked through it, and we've just stayed diligent and worked through our safety protocols. But I'm sure you're thinking, well, where do I start? What can I actually focus on today? And it's really best to just pause and review where you are, think about your strategy and what you already have documented, and then inventory your resources and think about what your main objectives are, and then make sure that as you work through your plan, that all of the elements of your plan connect back to your objectives. So we want to talk about 3 key things that you should know and keep in mind as you work through your own plan. On the next slide, we'll talk about those 3 key things. So what I recommend to you today, number 1, just make sure you have the systems, the processes, and the equipment you need to keep your people safe. And then second, and almost as important, is providing people with the confidence that you're putting their health first. So when you put the systems and processes in place, you need to communicate to your teams that their safety is critical and important to you. And then finally, number 3 on our list is keep in mind that today more than ever, our employees and our workers, their family commitments are front and center. Many have been working from home virtually. They have had challenges with childcare. The lines of their work life and their home life have really been blurred, and they're still working through some of those challenges. So safety is the number 1 thing that's important to them, but also a safe return to work and a safe return to daycare or child care is almost as important, if not as important. And so keep that in mind as you put your plan and your strategy in place, that they might be working through those other personal items on their own safety checklist. Finally, we have some great resources available to you, and then we'll open it up for some questions. So we wanted to, there are tons of resources out there, and I'm sure that the Chamber, I know that this is, I think, the 12th webinar that's been provided. And so I know that there are a number of great resources already available out there to you. We wanted to add a few great resources too as well on the topic of safely back to work. We have some great resources that have been developed. So the first is called Safely Back to Work, and these are best practice protocols. And what I gave you today is really just a snapshot compared to what's in these best practice protocols. It's tons of great information down to a very tactical industry specific level that will help you work through the best practice for safety protocols for your work site. So that's available here, and the link is available, and I know that the plan is to make this available to you following the call. The second is a practical guide to a safe restart. This is just a general overview on what we're seeing globally and some practical guides to a safe restart. And so this is also available on our website, and we're happy to share this with you. Just visit our website, and we have a number of great workforce resources available to all employers. So that's the third resource we have for you. That's the home of all of our employer resources. I've given you the web link here. It allows you to go and navigate a number of great employer resources. So the ones I've talked to you today are mostly about safety, but we have a number of other great employer resources out there. Tips for working virtually, for managing virtually, for managing the challenges of the pace in which we've gone through change. There's just all kinds of great employer resources out there. So we gave you a little snapshot here, but our Work Smart guide during COVID-19 for employers is available to you, and you can go out there and reach any of our resources. All right, so let's go ahead and move on to questions, and I will open it up and see what we have.
Thank you, Mindy. I have a question from the audience. With the wearing of masks, how have you conveyed customer experience interactions that now mask facial features?
Yeah, that's a great question, and that's something that has been, I think, a challenge trying to remind employees and workers to keep their masks on for safety, as well as our visitors for safety. And so a few of the things we've done is really provided some training to our workers on, again, the safe use of masks and the importance of using them so that they're not constantly removing them and taking them up and down. And then also just some practical tips, things like remembering to think about the inflection of their voice, although that can also be muffled. That's one of the challenges of masks, but understanding that it's important to make sure that they're using tone and inflection of voice and perhaps being a little bit more verbal than they would have been in the past if that's not their nature, because you can't properly or effectively see facial expressions. The same thing with just enhancing, their facial expressions, where perhaps they perhaps would have made movement with their eyes before. We provided some guidance on how they can interact and think about their smile reaching their eyes, or making sure that they're contacting and keeping eye contact in a more significant way as they use masks. So those are a few of the things that we have advised our workers in those work sites, but it can be a tough balance for sure, because the natural tendency, particularly in environments where people want to be friendly, is to remove the mask so that they can convey those facial expressions, and that can be difficult to maintain safety. So I'm curious also if there are tips that you guys have used. I'd be interested in hearing those ways that you've addressed that with your own staff.
Thank you. Are there any additional questions from the audience? Okay. Mindy, you've done a wonderful job of detailing the steps businesses will need to take in preparing for a safe return to work. So much so, there are not many questions left for the audience, so that's a great thing. I think I see one coming in chat. Hold on, one did just come in. Awesome.
Sure.
Okay. We know managers will encounter a myriad of situations. What are the EI suggestions?
And I might need some emotional okay, thank you. Thank you. you were reading my mind and the questioning look on my face. So emotional intelligence suggestions. We've had a lot of conversations. I think that I'm going to expand this question just a little bit to say, I think that one of the trends we have seen with our managers in particular, but also the managers we work with in our client sites, is just better understanding how to manage differently through these times. And so that can take a different form depending on the status of your work site. For many of our managers, it was learning how to manage in a virtual environment. For other managers, it was learning to manage and talk about safety and health in a different way, because there were some concerns, certainly a lot of concerns up front about feeling like we were invading someone's privacy by talking about health checks and health questionnaires. And then also really just understanding and navigating some of the personal pressures that our employees are going through. So those are just really three key areas that we've seen managers either struggle or excel during this time and have a lot of questions. And so I think all of those pertain to emotional intelligence. It's really understanding how to be empathetic and how to manage the business at the same time under a lot of pressure, and including our managers are under a lot of pressure. So a few things that we have seen and done during this time would be really increasing our training. One of the trends that we've seen, and normally when we go through this type of economic challenge, we see training budgets cut and we see a reduction in training investment. And that's something that's been very different about this challenging time that we've been working through, is that training budgets have actually sustained, or the need for training has gone up, because a lot of companies have found themselves investing in training and making sure that they were providing their workers, but specifically their managers, with the tools and the training that they needed to navigate this environment. So certainly training investment is one way that we've seen this managed. Another is really just providing guidance to our managers to ensure that they know how to navigate those personal concerns that their workers might have. And so providing them with guidance, with the contact information for EAP, and really more frequent check-ins from our HR team are ways that we've tried to make sure that we're navigating what our managers are facing. Great question. And I think that we are close on time. So yeah,
Yes,
I don't
we
want
are.
to take any longer, but thank you so much for having me today. It's been a pleasure to be here, and happy to answer any follow-up questions, and certainly want to provide the resources that are in the deck. So thank you so much for having me.
Thank you. Thank you for joining, Mindy. Thank you all for attending today's presentation on preparing for a safe return to work. We hope you found today's content valuable. Again, we would like to thank our presenter, Mindy Schestag, for the important information provided today. You will receive a brief survey of the webinar. We would appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar and any slides will be made available to you via email within 24 hours of the webinar. Thank you all. Stay safe and healthy during this time. Take care.
Thank you.